Hey everyone, welcome back to the FU Cancer Podcast. Joining us today is Scott Capozza, an outpatient physiotherapist dedicated to oncology rehabilitation at the Yale Cancer Center in Connecticut. He is among the first class of board certified clinical specialists in oncologic physical therapy in the United States and holds several leadership positions within the American Physical Therapy Association. Scott has taught as an adjunct professor in oncology physical therapy for multiple universities in Connecticut and has delivered lectures to physiotherapy programs around the country, educating students, physiotherapists, and oncologists about the benefits of oncology rehabilitation. He has presented professionally at the state, local, national, and international level and has been a co-author on several peer-reviewed publications. Scott is also the co-author of a chapter called Young Adult Survivors in the textbook Oncology Rehabilitation, a comprehensive guidebook for clinicians. Additionally, his patient perspective piece, Patient is Otherwise Healthy, detailing the late effects faced by adolescents and young adults with cancer, was published in the JCO Oncology Practice in 2024. Patient is Otherwise Healthy, available at ascopubs.org. Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Well, Scott, welcome to FU Cancer. I really appreciate you taking time out of your schedule to chat with us today. So thank you for being here.
No, it's an honor. I'm happy to be here, and it's so exciting what you all are doing there with FU Cancer, and I'm excited to see what the next year is going to bring as well.
So just to get us started, why is collaboration between physical therapists and dietitians in particular so important in supporting cancer survivors, especially when it comes to linking exercise with nutrition?
Yeah, there's such a huge interplay between a physical therapy and rehab professionals and dietitians. I say this all the time to my patients, as well as my colleagues, that you know you have to be able to fuel yourself in order to be able to move yourself. And so if you're not fueling yourself properly, then you can't be an active participant. You're not going to get an optimal session out of physical therapy if you're not fueling yourself properly. And so and with the cancer population, that is such a challenge. And that's why it's so important that our patients are connected with dietitians to make sure that they're getting, the right nutrients, and they're getting enough calories in, and they're getting enough quality calories in, to make sure that, that they don't lose muscle mass, and that it helps fight fatigue. And so therefore we have to be able to work together. We have to be able to reinforce what each other are saying, so that way that patient can make it through treatment, and then hopefully make it through long-term survivorship as well.
So, have you in your practice been able to pinpoint some nutrition related issues that cancer patients most commonly experience that may negatively impact their ability to participate in physical therapy?
Yeah, two of the populations that I work with specifically are patients with GI cancer, specifically pancreatic cancers, as well as our patients who have any kind of a head and neck cancer. I know that our patients with GI cancers, especially pancreatic cancer, they lose a lot of weight, and they lose a lot of weight very quickly. And so often it's muscle mass that they're losing, and you can see it in how they present themselves, that they lose muscle from their shoulders, they lose muscles from their hips, from their legs, from their glutes, and therefore it makes it really hard for them to do simple things like getting out of a chair, or going up and down stairs, or to be able to take a plate and be able to put it up, and reach up overhead. So I see that very often in patients with pancreatic cancer, who have nutritional concerns because of that. And then again, for our patients who have head and neck cancers, who have, swallowing difficulties, chewing difficulties, food tastes different now, especially if they've had radiation therapy, if they've had any surgery to the mouth or to the neck. And so again, if those patients aren't able to get quality calories in, they start to lose weight, they start to lose muscle mass. And and that's where we can sometimes see these patients who experience sarcopenia. And and so again, we need to be able to make sure that these patients are connected with a dietitian to make sure that they can get calories in some way, somehow, so that they don't continue to lose weight, they don't continue to lose muscle mass. And then they've got to work with me in physical therapy again to try to optimize what they've got as far as muscle mass and maybe again try to build muscle. But they can't do that unless they are fueling themselves properly.
Well, we know that something that comes up often when we talk about building or maintaining muscle mass is supplements. So, what are some of the most common misconceptions or even risks associated with supplement use during cancer treatment?
One of the big things that the dietitians that I work with educate our patients on about supplements is that how supplements are not regulated by the FDA, and therefore, you know, patients could run into a situation where the supplements that they take are interfering with the cancer medications that they're supposed to be taking, therefore rendering those cancer treatments, because maybe, for example, like hormone therapy for our patients with breast cancer, rendering them inefficient, and therefore, that is not good for overall survival for our patients. So one of the classic things that I see with our patients with breast cancer, for example, if they're on tamoxifen and they take milk thistle as a supplement, those two components compete for absorption. And so therefore, the tamoxifen isn't getting absorbed into the body and it's not doing its cancer prevention um, like it's supposed to. And that could help, that can impact long-term survivorship. So that's where we need our dietitians to really step up and talk to our patients about the misconceptions about supplements. But I hear it. I hear that as a physical therapist. My patients will ask me, they'll say, "Oh, or I might even just hear it in conversation. We might be working together and I might say, yeah, you look like you're putting some muscle back on and this is looking good. And they said, yeah, I've started to take supplement XYZ. And I said, oh, have you talked to your dietitian about that? And they said, well, no. And I said, well, yeah, but you're also taking, this hormone supplement for your cancer treatment. And so you have to make sure that you talk with your dietitian and you talk with your medical oncologist to make sure that those things that they don't compete with each other.
Yeah, I think that's a super interesting point and a perspective where many times we say, what medications are you on? And your physician reviews those medications, your dietitian's going to have conversations. But when we're taking supplements, we may not think, oh, I better mention that too, right? We just think of like what's being prescribed, what am I getting from the pharmacy? And
Mhm.
the other stuff's probably okay. When, like you said, it could be actually causing harm. So we want to be super careful and transparent about what we're taking.
Absolutely.
So I want to pick your brain about a new publication in the New England Journal of Medicine called the Challenge Trial. So this has sparked a lot of discussion, as I'm told, in oncology rehab. So tell us about that study. What did we learn from it, and why should patients care when they're hearing about it?
Christina, I feel like the challenge trial is the holy grail when it comes to rehab on within oncology and exercise oncology because this is what we've been looking for. We've been looking for definitive proof that shows that exercise and rehab actually improves cancer outcomes. And that's what the study did. And it was great because the study was a large study. It was almost 900 people that were enrolled in this study. So it was pretty powerful from a perspective of, it wasn't just some little pilot study with 20 people in it. It was a big study with 900 people. And one of the other things that was really important that made this study so powerful was that they followed these patients for 3 years. And so the exercise intervention, the patients worked with the rehab professionals twice a week for a year, and then continue to have these checkpoints with them for 2 additional years after that to help with adherence. That's one of the things that I see so often in long-term survivorship is that adherence can be challenging if you don't have that touch point with somebody. And so they were able to track these patients for 3 years. And when they ran all the data, they found that those that were in the exercise intervention, they improved um, their risk of or they decreased their risk of progression of disease
Mhm.
by like 27-28%, which is incredible. So just by exercising, just by moving, you reduce your risk of the cancer coming back. And again, the challenge trial was specifically for individuals with stage 2 and stage 3 colorectal cancer. But then they ran the data even more and they looked at incidence of death, and they found that those who exercise reduced the risk of death from cancer by 37%.
That's
So,
remarkable. That's
right,
huge.
that is huge. 1/3.
Hmm.
You decrease your risk of death by 1/3, and that's just the exercise. And then I guarantee you put the nutrition aspect of that into it as
Hmm.
well. Now you're probably at 2/3. You've
Hmm.
just decreased your risk of death from cancer because you're moving and you're eating right. And then the last thing that I thought was really, really interesting that they did some other little analysis. They say a little analysis is a big analysis where they put a whole bunch of factors up to see what were the most important factors when it came to overall survival. And they actually put exercise up against oxaliplatin chemotherapy. And those that got the oxaliplatin chemotherapy had a 7% risk of reduction in their cancer coming back. The exercise group, it was 8%. So exercise was better than chemo.
Wow.
And that's what I think a lot of people are. They hear that and they say, oh. And so we don't want to say don't do chemo, obviously. But the fact that we have this data now that shows how powerful exercise and rehab can be in improving your disease-free survival and your overall survival is so incredibly important.
Mhm. So I want to dig a little bit deeper into this because I think when we hear the word exercise, you know, that can mean a lot of things to a lot of people. So in this study, or kind of generally speaking, are these people training for a marathon? Are they walking? Like, what is that? How is that exercise defined?
Yeah, that's an excellent question. And I have that conversation so often with my patients, especially in long-term survivorship, because, people will say, well, I use the stairs and I park further away when I go to
Mhm.
the supermarket. And I said that, and that's great. You're
I
you're
mean,
you're
my
moving.
Apple Watch congratulates me for standing up. So
Right.
the bar's
Right,
not super high.
exactly. Right. And those are all important things. Those are all great and foundational things to build off of. And then to build off of that, the exercise is when you take you do an intentional movement where your heart rate goes up, your respiratory rate goes up, you were burning more calories. And again, it's intentional. I think that that's the big part of it there. So one of the great things about this study, with the challenge trial, was that they wanted people to exercise. I think it was 3 to 4 times a week for 45 minutes. But they actually gave the patients variety. They gave them the option, they gave them the autonomy, which I think is great, of what they could do. So they could run, they could walk, they could bike. I saw kayaking in there, and I said, so that's great. And I think that that is even more important that they said everybody's got to get on this treadmill and walk for 45 minutes, 3 to 4 times a week. Not everybody loves walking on a treadmill. And so I love that they incorporated autonomy, which is obviously, Christina, so important that we try to give our patients with cancer some autonomy back.
Yeah.
where they don't feel like they have any autonomy in the first place. So these patients were given the autonomy to pick whatever their exercise was, but it had to be, 45 minutes. It had to be 3 to 4 times a week. They had to record all of it. Um, and so I think that really, again, speaks to, you know, the how powerful that study was.
There any evidence to show impact on cancer treatment tolerance as you're increasing your physical activity?
I am. And I would say I just saw a study, I just downloaded a study today. I haven't had a chance to read it. And it actually did talk about both. It said in isolation, exercise, and then in isolation, nutrition. And I think they found one study where they actually did both, where
Mhm.
they looked at exercise and nutrition as far as outcomes. And you can guess that patients who exercised and kind of optimized their nutritional status had better outcomes. But yeah, I see it. I just saw somebody today who's going through chemotherapy. He's getting chemotherapy every 2 weeks for colorectal cancer. And I just did a progress note on him today. And we've been working together and he's been doing his home exercises. He does his exercises with his son. His son comes with him to his PT session. So his son actually gets to see what his father does and says,
Mhm.
"Oh yeah, well we can do something like that at home. We can set something up like that at home." So he's been really consistent with it. And and he has like I have the data to show that even though he's still going through chemotherapy, he's getting his chemotherapy every 2 weeks. He's gotten stronger. His
Mhm.
30-second sit to stand went from 9 to 12. His grip strength went up 8 points on his right hand and 10 points on his left hand.
Mhm.
And his 2-minute walk test, he increased that by 25 feet. And so yeah, he's able to tolerate chemotherapy. He's getting through chemotherapy and he's actually getting stronger while going through chemotherapy.
So for someone who's just been diagnosed with cancer, what are some safe and effective ways to begin an exercise routine before they've even started their treatment regimen?
Christina, you just asked the prehab question, and I love prehab. And prehab, again, is so important for both of us, for dietitians and for physical therapists to be able to meet these patients, because some of these patients might be coming into treatment and they may not be in, the best shape. They might not be, they might already have some pre-existing conditions such as diabetes or hypertension, and so those things all have to be addressed. And and we do know that our patients who are able to engage in some level of prehab, both from a physical perspective, but also from a nutritional perspective, to be able to optimize their function, their pre-surgical function to improve their post-surgical outcomes.
Mhm.
So in order to meet those patients where they're at, it is important to get a sense of what do they like to do for exercise? What do they have access to for exercise? Some people might have a Peloton and some people don't. And so you have to be able to understand what do they have access to? What are their time commitments? If this is somebody who is retired, okay, they've got a little bit more time. But somebody who's got 3 kids, and they've got to get these kids to soccer practice and everything else,
Mhm.
that takes a little bit more finessing and a little bit more planning as far as how are we going to engage them in exercise. They may not be able to go to a gym. I tell my patients all the time, here's my dirty little secret. I don't go to a gym either. I
Mhm.
don't have time. I have 3 kids myself. And so I have learned that I'm going to go for my walks or I'm going to go for my hikes when my kids are at soccer practice,
Mhm.
or I'm going to drop my kid off at swim practice. I'm going to come home. I'm going to get on my bike and ride my bike. And then by the time I'm done, I can shower and then I can go back up and I can pick them up from swim practice. So, but you have to sit, you have to listen to that patient and be able to know who that person is before you can design an effective exercise program. You and I both, right? Dietitians and physical therapists both, we can't just hand people a sheet of paper and say, go exercise, and eat your fruits and veggies.
Right. Doesn't work like that.
It does not work like that. That's why, you know, our jobs are pretty secure because
Hmm.
we have to be able to listen to the patient and meet them where they're at.
So, thinking about people who are in active treatment and dealing with symptoms like fatigue or nausea, or they're experiencing those reductions in their strength, how can exercise be adapted to really meet the patient where they are in their phase of recovery?
I still offer telehealth visits. And so I tell my patients, listen, if and another side effect is diarrhea from cancer treatment, right? And I say, listen, if you don't feel comfortable getting in the car and driving here because you've been having, issues with diarrhea, okay, then we're just gonna switch your appointment to a telehealth visit. That way you're right there in your home. And sometimes I do like that because again, I get to see their home environment and I get to see, okay, well, what do you have? How can we set this up so that, if you're experiencing diarrhea or you're experiencing nausea or you're experiencing fatigue and you don't feel up to coming to the clinic, okay, well, how can we set this up at home? And especially for my folks who are experiencing cancer-related fatigue, I say break it up. You don't have to go for that 30-minute walk. You can try to go for a 10-minute walk after you've had breakfast. And then you can kind of lay low and you can kind of see how the morning goes. But then after you have lunch, if you feel like you get a little extra energy, maybe you go for a 10-minute walk after lunch. And then same thing, if you can maybe go for a 10-minute walk after dinner, I wasn't a math major, but that adds up to 30 minutes. And you
Yeah.
got your 30 minutes, but you didn't have to do it in the totality of it all together. You can break it up. Just like sets of exercise. I'll say, listen, if you can even just get one set of exercises in, you know, 2 days after you got chemo, because I know that that's going to be the day that you probably are the most fatigued, 2 to 3 days post chemo, just do one set of exercises and that's it. And then as you start to come out of it, as you start to regain your endurance, as you get further and further from that chemo cycle, okay, well then try to go back to 2 sets of
Hmm.
doing those exercises. Or maybe do the exercises in sitting versus in standing. I have this conversation so often, Christina, with patients about energy conservation, um, about how everything we do, you and I right now having this conversation takes energy. Loading the dishwasher, doing a load of laundry, taking a hot shower, all takes energy. And so when you put it in that context and you say, okay, you're getting this heavy hitting chemotherapy and you are going to be fatigued in those 2, 3, 4 days post chemo. You have to look at your day and figure out what are your priorities, right? If your priority is you want to go to your kid's soccer game, then guess what? The laundry's not getting done that day. You have to look at it from what's the most important thing that you want to do because you're only working with a half tank of gas to start with.
Hmm.
So that energy conservation conversation I have so often with patients when they're in the middle of active treatment, um, and to talk to them about how can we, you know, kind of like almost like roll with their chemo as far as their exercise intensity.
Hmm. So, as individuals are coming off treatment, they're wrapping up their chemotherapy plan, regimen, whatever, what guidance can you offer to help them safely get back to baseline? Or do they get back to baseline? Like, what does that look like for the long term?
Mhm. I think that's really important. We have to sit down and we have to frame realistic short-term goals and long-term goals. If the long-term goal is that this person wants to run a half marathon, that's great. That's a fabulous long-term goal. Your short-term goal is you got to finish a 5K first.
Hmm.
So, okay, so here's the plan. You are going to plan and you are going to train for your first post-treatment 5K. And you gotta do that, and you gotta get that under your belt. And then you're going to have to train and complete your first post-treatment 10K before you then think about doing your first post-treatment half marathon. You can't just go right into trying to do your a half marathon right after treatment. Yeah, I have found actually, especially with some of my younger patients and some of my more active patients, that I do have to frame the conversation a little bit more and say, you know what it's like to have like an orthopedic injury, right? Like if you're a runner, you probably had shin splints at some point in your life. If you were a baseball player, I'm sure you threw out your shoulder or your elbow at some point. So what did you have to do? You had to take a little bit of time off and you had to heal and then you had to rehab it, and it took time to get back to that level. So you have to treat what you just went through with your cancer treatment as an injury. And so for my younger patients and for my more active patients, if I frame it that way, they
Mhm.
say, "Oh, right. I had this gentleman, I love this guy. He's an older gentleman. He's in his late 70s. Every year, he and his neighbor, they always do a 100-mile bike ride. I want to be like him when I grow up."
Mhm.
Um, had a neck cancer, had a invasive tongue cancer. So again, lost a lot of muscle mass, worked with our dietitians to try to to try to put some weight back on. Um, and he was trying to get back to the gym and trying to do his post or his pre-cancer workouts
Mhm.
after radiation therapy. And I said, okay, well, you're a cyclist, so you must have pulled your hamstring or you must have pulled out your back or something at some point. He goes, "Oh yeah, I've had all those injuries." I'm like, "Okay, did you jump right back and do your 100-mile bike ride after you pulled your hamstring?" And he says, "Oh no." I'm like, "That's it." So again, I think, dietitians and physical therapists, we also have to be a little bit of a psychologist when it comes to figuring out how to tap into that. But that's my
Mhm.
advice to people is to say short-term goals and use those short-term goals as stepping stones to get to whatever your long-term goal is.
Scott, we know that finding professionals with oncology specific expertise can be challenging for a lot of folks. So, what should patients look for when they are seeking a qualified physical therapist or even a personal trainer?
Yeah, that's an excellent question. For physical therapy, for example, yes, we have board certification in oncology, just like dietitians have
Mhm.
board certification as well. I've always actually pointed to the dietitian and said, "Wow, the dietitians like you had this figured out a long time ago. It took us physical therapists a little bit longer to figure that out. We didn't have our first cohort of board certified specialists in oncology until 2019." Um, but so for on the physical therapy side of things, there's an offshoot of our national professional organization, the American Physical Therapy Association. And there's a website, and it's very simply choosept.com. And so somebody can put in their zip code, and then they can also put in what specialty they are looking for. So they can put in, are they looking for somebody who is a specialist in oncology physical therapy? Or are they an expert in pelvic floor physical therapy? Or are they an expert in pediatric physical therapy? Whatever the specialty might be, and then you set the radius. How far away do you want to go? 10 miles, 25 miles, whatever, and it'll find you people that are in your area. So that's always a good start from the physical therapy side of things. Again, that website is choosept.com. And then I'm pretty sure that for our personal trainers, they also have their own cancer exercise trainer certification. The same thing, they have to study and they have to do so many hours of working with individuals with a history of cancer, and they have to sit for a national exam, just like I had to sit for a national exam as well. And I think on the ACSM website, you can also find professionals in the area, who are personal trainers who have that CET certification from the American College of Sports Medicine.
That's wonderful. Well, thank you for that explanation and those resources. Your professional and personal perspectives clearly have informed your work and your approach to patient care. So, how has your lived experience with cancer influenced how you treat your patients to really help them move through and beyond their cancer treatment?
I feel that I have a certain level of understanding because I've been through it myself. I was diagnosed with cancer when I was 22, and I had surgery and I had chemotherapy. And at this point in my life, I'm a long-term survivor. I'm actually, if you think about it, I've been a survivor longer than I haven't been a survivor at this point. And it's funny, Christina, because when I graduated physical therapy school, oncology rehab really wasn't a thing. And even if it was still too new and too raw for me that I didn't want any association with it. But now I appreciate what having this lived experience means and the that kind of like that extra level of empathy that I can use, that I can apply for my patients. And I definitely I don't lead with it. I don't tell my patients about it. Um, right off the bat. I will say patients are pretty savvy these days. I've had more than one patient who've come to me and they said, I know who you are. I looked you up. And I say, oh, well, I'm glad Facebook wasn't around when I was in college. Um, but I know I've had several people who have said, I'm coming to you because not just because you're a specialist as a professional, but because you get it.
Mm-hmm.
And so I get it. I get what it's like to be nauseous from chemo, and I know what it's like to be deconditioned, and especially as a young adult with cancer,
Mm-hmm.
what it's like to watch your friends all go off and get jobs, and instead you are in a chemo room. Um, so, so I think that having that experience and having that in my back pocket, so to speak, my patients kind of figure it out after a while. A lot of them say, "You're not like a regular physical therapist," and I said, "Well." Not really sure how to answer that. Um, but that's how I kind of take my lived experience and I try to just create this environment, this really open and honest environment, in a safe environment for my patients too. I tell all my patients on the first time I meet them, I said, this is a safe space. You know, and I understand that there's so many emotions that go along with the cancer diagnosis, whether it's in the prehab side of things, it's still new, it's still raw, you're still trying to figure it out. If you're in the middle of it, if you're in active treatment and you're not feeling well, or if it's in the survivorship phase of things, well, what do I do now
Mm-hmm.
phase of things. And I say, listen, this is a safe space. You can cry, you can swear. Yeah, but if you feel like you need to punch anything, punch the pillow, don't punch me. Um, and but I think by just kind of leading off with that, they know that okay, you know, uh, they can let their guard down sometimes, and they don't have to feel that they have to like hold it all in when they're with me.
It's amazing. Well, your patients are so lucky to have you. And, we're so lucky to have you in our FU cancer community. So thank you for sharing your expertise with us tonight and really just for leading these honest conversations. I think it means so much to all of us. So thank you again.
Yeah, thank you for having me. And it's amazing what you're building there, and it's really exciting, and it's so needed. It is
Mhm.
so needed what you're doing, and the more cancer survivors that we can reach, the better.
Well, listeners, we hope you found today's episode helpful. To learn more, you can follow us on Spotify, Apple Podcast, or wherever you get your favorite content. And of course, visit our website at fucancer.health. We would love to have you join our network and check out our new digital tool that's online now. So thank you so much. Until next time, I'm Christina Rollins. Thanks for listening.